Etiologies. Some of the benign etiologies include granuloma from a previous maybe fungal infection. The most common systemic fungus, histoplasma. Hamartomas and slowly resolving local pneumonias. Hamartomas are a big one. What is a hamartoma? A benign lesion, and it is overgrowth of that cell, but it's indigenous to that organ, correct? Whereas if it was more ectopic, what do you call that? You call that a heterotopic rest, or you call that a choristoma. Keep that in mind. You know, your exams and boards love such questions. Benign. Clinical presentation. Incidental findings, these benign lesions, asymptomatic. Diagnosis, biopsy. Well, watch and wait. And hopefully that's good enough. Lung nodules in cancer, we'll take a look at that which favors benign and that which favors malignancy. Pretty much what we've already kind of talked about. If it's benign, no growth. Malignancy, increased proliferation. Benign, less than 1 centimeter. Malignant, larger. Benign, calcified. Malignancy, we have what's known as spiculated calcification. It looks like the nodule, but then it looks like there's spicules coming out from it, and that's not good. Or even non-calcified lesion. Benign, non-smoker. One big exception. Good. Adenocarcinoma. Smoker. Many of them, including small or squamous. Benign, no associated pleural effusion. If it's malignant, we talked about it being good. Hemorrhagic-like, invading chest wall. Benign, not glucose, avid, on PET scan. What does that mean? Big time. Positive emission tomography. This has revolutionized the way in which we handle cancers and how we interpret it. Cancer, as we talked about earlier, favors a particular type of pathway in biochemistry. And it's not anaerobic, it's not aerobic, it's right in the middle. It's called Warburg. Amazing. Even if that cancer is accepting, we had this discussion earlier, let us now bring it up one more time. This cancer, even if it is receiving and being supplied with proper amounts of blood, still wishes and prefers to create or to undergo quite a bit of fermentation. So therefore, there's going to be increased lactate dehydrogenase activity. That's a seriously malignant issue. If it's a benign etiology, the Warburg effect, the Warburg pathway, is not the way that it goes, and therefore, in terms of its consumption of glucose, its consumption and really the production of lactate dehydrogenase is just not going to be there. So your PET scan is going to be negative for benign. That's huge for us. If it's positive, you're thinking about malignancy.